Member for Nanaimo-Cowichan.
Thank you, Mr. Speaker, and I too am pleased to rise in this House today and speak to Bill C-442 because I'm sure I'm like many other members in this House. I've got constituents who have suffered from Lyme disease, and sadly for many constituents it has taken them months, if not years, to get an adequate diagnosis, and in the meantime their lives have been lives of misery as they simply have not been correctly diagnosed nor received the proper treatment. Now, what Bill C-442 aims to do is track the incidence rates, create educational materials to raise awareness about Lyme disease, and establish testing and treatment guidelines, as well as track the related economic impacts of Lyme disease. It also supports the research and implementation of better and more reliable diagnostic testing, as well as increased education and awareness amongst physicians. I want to turn just for a moment to a Globe and Mail article that was in the papers on April 27th, and the headline was, "Lyme disease on the rise in Canada linked to ticks." And the subheading is, "This is the first in a series examining the health repercussions for Canadians due to a changing climate. First up, Lyme disease." And in the article, they note that most Canadians think of Lyme disease as a rare illness that affects hikers bitten by ticks in the deep woods. Infected individuals develop a bullseye rash and go on to antibiotics for a few weeks to clear it up. Problem solved. The trouble with this picture, promoted for years by Canadian health authorities, is that it does not begin to capture the true threat of Lyme disease, which in its chronic form can turn into a life sentence of debilitating joint pain and neurological problems. Disease-carrying ticks in Canada have increased tenfold in the past 2 decades, spread by migratory birds and nurtured by warming climates that allow them to thrive in our own backyards. While reported cases jumped 146% between 2009 and 2012, advocates say that testing is inadequate and doctors lack awareness of Lyme, resulting in gross underreporting and underdiagnosis of this rapidly emerging infectious disease. And Mr. Speaker, I can certainly say that on Vancouver Island, what some of the medical community response has been, is that Lyme disease doesn't exist on Vancouver Island, so you couldn't possibly have Lyme disease. And of course, when some of the constituents were able to get the testing outside of Canada, sadly, spending thousands of dollars, it was demonstrated that they did in fact have Lyme disease and then needed to be on prolonged courses of antibiotics to deal with it. Later in the article, it says detecting Lyme disease is an evolving science, however. Recent studies have shown that different strains of Borrelia, the bacteria that causes Lyme, may target different organ systems, triggering a variety of immune responses. While the responses vary, one strain alone can affect skin, joints, the heart, and nervous system. Canadian health authorities recognize the need to detect different strains of the bacteria, the PHAC, that's the Public Health Agency of Canada, said in a statement, adding that Canadian labs are using updated screening tests that are reactive to a much broader range of the strains. But Wilson said that from what he's heard, and Mr. Wilson is with an organization, a not-for-profit, that's been trying to raise awareness, said that from what he's heard in the Lyme community, Canadian patients are still being offered the same old test. The standard Western blot test detects only a lab strain of Borrelia and its close cousin. The second test, known as the ELISA, or ELISA, isn't sensitive enough to distinguish Lyme disease from such illnesses as lupus or rheumatoid arthritis, according to Dr. Brian Fallon, director of the Lyme and Tick-Borne Disease Research Center at Columbia University. Both are known to have significant limitations, Fallon said. Newer tests are available at private U.S. labs. Private U.S. labs can detect all strains and species of the bacteria. Although these tests have their own pitfalls, they are really an improvement on the standard test, said Fallon, who saw no reason why they should not be widely used in Canada. And they conclude the article by saying, unless Canada starts doing a better job at detecting Lyme disease, we're going to continue to have most people in the chronic category because they're just not being picked up. And, Mr. Speaker, this is a devastating effect. I mean, certain people talk about the economy, but it's a devastating effect on people and their lives, on their families. Now, part of the challenge with this is that, as I mentioned, in Canada, many patients report issues with the testing and treatment of Lyme disease. The different types of blood tests performed to identify Lyme disease often yield inaccurate results. And this may mean that patients who in fact have Lyme disease are not diagnosed, or even more worrying, they're misdiagnosed with multiple sclerosis or chronic fatigue syndrome and do not receive the appropriate treatment, exacerbating their symptoms. Some patients Some patients even have to travel to other countries to receive treatment because it is inadequate in Canada. The NDP believes that this bill would improve the treatment and outcomes for Lyme disease sufferers. Canadians need a national strategy on Lyme disease to ensure that the testing and treatment options in Canada are improved. Therefore, we support this bill and believe it lays out a concise plan for educating Canadians about the disease and, more importantly, providing a better quality of life for Lyme disease sufferers. Now, Mr. Speaker, there's just a little bit of background on it. This is, as I mentioned, this disease is spread by tick bites. And these ticks are small parasites that feed on the blood of animals and humans, and they pass on Lyme disease when they feed on mice, squirrels, birds, or other animals who carry the bacterium and then bite humans. Ticks are most common during the warmer months from spring through to late autumn. Canadians who live in areas that have mild winter temperatures and minimal snowfall have an increased risk of coming into contact with ticks, describing the climate on Vancouver Island. Climate change is one of the factors causing more and more regions to be at risk with warmer weather, increasing tick distribution across many parts of Canada. Now, Mr. Speaker, I've been working on this file for a number of years, and back in 2010, I had written a letter to the then Minister we had a back and forth of a number of letters. I'd written a follow-up letter asking for further clarification and action because in part the response from the government was, well, treatment and diagnosis is a provincial responsibility and so really, there's not much role for us. And I was trying to argue that of course there's a role for the federal government and part of that role is around leadership. But I reminded the minister that the federal government has a clear role to play in establishing the guidelines, and it is in this area that most action needs to be taken. I went on to remind the minister that Canada Health Act's principle of reasonable access to health services without financial or other barriers is an important aspect of what Canadians expect in our publicly funded, publicly delivered healthcare system, and that when we were seeing unequal access or seeing Canadians have to go out of the country in order to get adequate testing, that is absolutely providing a financial barrier. I went on the letter to say a number of studies have concluded that the tick vector is spreading rapidly in Canada, a process likely to be accelerated by climate change. Without current up-to-date information about the geographical distribution of tick vector populations, doctors may falsely discount a possible Lyme disease diagnosis and thus deny serological testing. In addition, the tick vector is also carried by migratory birds and is therefore not isolated to any one particular region. I quoted from the Canadian Medical Association Journal article published in 2009 that says the emergence of Lyme disease in Canada. It says effective enhanced surveillance involving federal and provincial agencies needs to be instigated, and that clinician awareness of Lyme disease will be crucial in minimizing its impact as it is an emerging disease in Canada. Further on, I said ultimately Canadians are receiving inadequate care or no care at all when it comes to Lyme disease, forcing them to leave the country to seek medical attention. This is a direct denial of their rights. New national guidelines must be put in place to address this serious contravention of the Canada Health Act. Canadians should have confidence in their healthcare system. Based on recent studies, the current guidelines simply do not take into account that Lyme disease is emerging in Canada and that geography cannot be relied upon to diagnose Lyme disease. In addition, the two-tiered testing is fundamentally problematic as it excludes many patients who have Lyme disease from the more sensitive testing that was available. Now, it was interesting in the response from September 15th, 2011 from the minister. The minister indicated in the letter that climate change is anticipated to accelerate the emergence of Lyme disease in Canada. Endemic Lyme disease risk occurs in much of southern British Columbia, but the vector here is less efficient and the risk is relatively low. Thank you, Mr. Speaker. So even a couple of years ago, the minister is indicating that at that point that the risk was relatively low. And I would argue, Mr. Speaker, that because the government wasn't doing the kinds of surveillance and follow-up that was required in order to determine the real incidence, that people were simply being excluded. Now, there has been some changes, and although the government has moved to look at making this a nationally reportable disease in Canada, many people simply do not trust those numbers. And so, Mr. Speaker, I certainly will be supporting Bill C-442. I want to commend the member from Sandwich Gulf Islands for bringing this matter forward. It's a very important matter for us in Nanaimo-Cowichan and in the rest of Canada, and I would encourage all members of this House to support this bill, and let's get on with developing that national strategy that's so important for our constituents. Thank you, Mr. Speaker.